Doctors, what is your most surprising, I can't believe I need to have this conversation with an adult story? I had severe asthma as a kid. I was intubated for a severe attack a few times. My parents were instructed to take better precautions in our home and went through instructions: more dusting, washing bed sheets, etc., and the big one, no smoking inside the house. So my parents agreed to all of this. A few weeks later, I'm back in the hospital. A doctor recognized me and came over to talk. Then he bent over and smelled my head. I'll never forget that. I thought it was so weird. He told a nurse to sit there and not let me leave with my parents. When my parents showed up, he asked point blank, "Did you not understand what I told you last time? Do you understand these attacks could be fatal? But we opened windows and have stopped smoking in her room when we put her to bed." And that's when they called Child Protective Services? Nope. If they did, nothing was done about it. This ranks surprisingly low in terms of bad parenting decisions on their part. I saw a patient for a follow-up after 3 ER visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler about every 2 to 4 hours with no relief. This raises suspicion to me, as the same meds are working in the ER. I ask him to show me how he's using it. He holds it about a foot away from his mouth and does 2 puffs and swallows. I felt really bad. He had never received any education about his illness or medications. We had a diabetic patient who kept coming back with extremely high sugars. We asked him if he was following the regimen we taught him by testing his blood sugar, using the sliding scale, measuring the correct dose of insulin in the syringe, etc. He went through all the steps and it sounded like he was doing everything right. We asked him to demonstrate the steps he took so that we could observe and correct any mistakes that he may have been making. He did everything written until the very last step. He drew up the insulin in his syringe, pulled an orange out of his bag, injected the insulin into the orange, and then ate it. Turns out that when he was taught to practice how to give himself subcutaneous injections with oranges, he didn't realize he actually needed to inject himself for the insulin to do its job. Did you repost this from that "What's the stupidest thing a patient has ever done" thread from a while ago, or does this same guy just keep turning up in hospitals? I mention because it's my favorite stupid person story to quote at people. Got placed doing a rotation on the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped, and it wasn't to help her walk on her post-op knee. This is the first response that genuinely made me laugh out loud. I can just imagine some cranky old woman swatting people out of her way. I have a cranky old woman story for you. My mom worked at a nursing home as a cook. They ended up having to take away the electric wheelchair of a resident that was 107 because she kept running people over when they made her mad. She was my mom's favorite resident. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics, but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor, probably of Chinese medicine. My friend is a student doctor and is on placement at a small-town doctor's office. She had a 70-ish-year-old woman come in with a complaint of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. That coming to the ER for a pregnancy test is a very, very expensive way to do it. Apparently, she didn't know that you could buy one at the Rite Aid down the block. Seriously, don't come to the ER for a pregnancy test, because the pregnancy test won't be the only surprise that you'll be getting. Also, if you have diabetes, you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ER with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. This hits hard for me. I had an uncle who I was very close to who was very sick the entire time I knew him. I know he had very, very severe diabetes, but I don't remember what else he suffered from. I have those distinct memories of him taking me to McDonald's so that we could throw the fries to the seagulls, and hanging out in the parking lot, and he'd always have the heat on full blast because the circulation to his extremities was so poor. By the time he died, he lost both of his legs and 4 of his fingers. The irony was that he loved basketball so much. He used to chase me around with his leg nubs and race me down the street in his electric wheelchair. He was really amazing. He never let me be afraid of his amputations or his condition. I even used to give him insulin shots, even though needles scare the crap out of me as an adult. He was a remarkable human being. I miss him, and I wish that he could have known me as a real developed person. Unfortunately, I was 6 when he died. I hope he'd be proud. Not a doctor, but when I was in Afghanistan, a local man came up to us on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor. So we got the medic to see him, and I helped unwrap his hand, and it was just huge. He had cut his hand very badly, and for whatever reason, he kept it submerged in diesel for 3 days before seeking help. His hand appeared to have soaked up a crapload of diesel, and it was just infected to heck, but it resembled a water balloon, and lightly touching it caused it to piss liquid. It was nasty. That the 30-plus cups of coffee he was drinking every day could possibly be the cause of his chief complaints, of anxiety and insomnia. He said he was not willing to give this up or try decaf. 30-plus, man, I'm such an amateur. Your heart thanks you for your amateur ways. I'm a paramedic and recently transported an idiot who self-presented to the local hospital who found he was having a heart attack, STEMI, and needed him sent to a bigger hospital for treatment. During my assessment, I asked him how long he'd been having chest pain. On and off for 12 months, he tells me. Any family history? One of the biggest indicators. Oh yes, Dad died of a heart attack. Brother died of a heart attack. Both of their first presentations stone dead on the spot. No about. So you have a 12-month history of intermittent chest pain and a family history of your closest male relatives spontaneously chucking Hardee's and dying, and you've never got it investigated? Furthermore, the only reason you came to the hospital tonight is that your family badgered you into it. I told him he needed a solid kick in the arse. To his credit, he agreed. So I'm only an EMT, but I want to weigh in here to this conversation. I had to tell a patient with severe pneumonia and the patient's family that you don't get sick, i.e. catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. My parents always told me that the reason I got sick was because I wore t-shirts to bed. Yes, mother, I got the flu because I exposed my forearms and hands as I slept, not because half of the kids at my school were probably off dying from it. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went because it doesn't bother her and she'll see if it gets better. This doesn't surprise me much, particularly if it's in the US. If it's not bothering her, I imagine concerns about the cost as well as any time out of work would be major deciding factors in that decision. Obviously though, not great to leave it untreated. How is this an acceptable way to live in a first world country? I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that. Getting my tubes removed did not remove my ability to get a period. That we women have a urethra, a vag, and an anus. Babies do not come from the urethra. This one was strange because she had me and my sister, so. That when you neuter a dog, you just remove the balls, not the red rocket too. China and Taiwan's sex ed was severely lacking, so my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you, you can get pregnant. If you kissed a guy, you could get pregnant. I'm still finding out years later misconceptions that my poor mother has about reproduction and explaining things to her. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. I worked at a vet clinic when I was in high school. One day, a vet came out of an exam room and asked me how to tell whether a puppy was a girl or a boy. Thinking it was a joke or a trick question, I said, "You flip them over and look, right?" The vet sighed and walked away. Apparently, this client, who fancied herself a breeder, multiple litters at this point, expensive breed, had asked dead seriously how you tell if a puppy is a boy or a girl. I had to explain to a client that just because his puppy had nipples did not mean it was a girl. So, not a doctor, but I work at the hospital. We had someone come into A&E because they needed their nails redoing. They genuinely thought it was a good idea to go to accident and emergency to have their fake nails taken off and redone because they had gotten too long and become uncomfortable. Talk about being high maintenance. Had a patient in our high priority area for DKA, sugar was in the 800s, stomach pain, nausea, vomiting, and the such. Pulled Burger King and gummy worms out of his backpack and then proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. CNA here. I did a patient's glucose the other day and it came back in the 500s. They were complaining of stomach pain and nausea, just really miserable. I reported the number to the nurse, and while we waited for insulin, the patient asked me to bring them ice cream. Why? Their reaction was very clear once I told them what their blood sugar was, that they knew it was bad. Heck, they started crying, but then immediately asked for ice cream, because that'll totally solve the problem. I mean, I'm a biggish girl, and I'm no stranger to emotional eating, but when your blood sugar comes back so high that the nurse has to drop everything to come to treat you, it's probably no bueno to reach for the sugar. The nurse and I were able to convince them to throw away the pile of crap they had on their table, soda, candy, piece of pie, etc., and that sugar-free applesauce was an improvement over eating ice cream. But man, the next day they were right back to order pizza delivered to the facility, and were not checking a single fruit or vegetable on their menu. My job is to support the patient, but damn, is it hard sometimes. I can only positively encourage them to select healthy options so many times. If they don't want to eat their vegetables, I can't force them to. Are you allowed to tell people that they will die within the next 5 years if they don't change? My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. We're waiting on that book of yours. Obligatory, not me, but my wife. She's a nurse practitioner and had to explain to a 40-year-old man that brown sugar did in fact contain sugar, and that is most likely the reason why he now has diabetes. The same man also adamantly insisted his wine consumption was not an issue because he only drank the dry stuff like Chianti, so it doesn't have any sugar. When my FIL was diagnosed with prostate cancer, he decided to deal with it by going vegan instead of getting actual treatment. He also cut out all sugar, going as far as refusing to eat corn because of the high sugar content, as cancer feeds off sugar. The kicker was that he was a raging alcoholic and would drink 2 to 3 1.5-liter bottles of white wine a day, refused to believe that white wine was full of sugar because it doesn't taste sweet. A conversation I recently had with my oncologist. Is it true that cancer cells feed on sugar? All cells feed on sugar. But is it going to affect my relapse chance? Oh goodness, no. A normal amount of sugar or fat in your diet isn't going to give any residual cancer cells the boost that they need to reestablish, nor is any tumor going to grow or not grow from lack of sugar. My mom tells it so much better, but here's a try. My mom was the head nurse at a clinic here in Houston in the 80s. She worked for an old World War II doctor that had gone into private practice, old school GP, when he returned back to the States. Well, one afternoon, she told me that they had a patient come in that was running a high fever and was complaining of pain in her pelvic area. Mom also tells me that there was a stench coming from the woman's lap that can only be described as enough to gag a maggot off a meat wagon. She begins to interview the patient, who told her that she and her boyfriend had been sexually active and that she has been in pain since. She thought that the woman may have contracted an STD and asked her to undress and wait for the doctor to examine her. The doctor arrives and closes the door, only to reopen it a few seconds later, mentioning about the need for fresh air. The doctor noticed that there was vaginal discharge and began to question the patient about her sex life. Was it protected, non-protected, etc.? According to Mom, the patient told her, "No doc, we always use a rubber." The doctor looked down and then noticed that there was a small rubber band extending from the woman's vag. The doctor reached in with his gloved hand and pulled it out. What came next can only be described as a magician pulling the magic cloth out of someone's mouth. One rubber band after another came out over the course of the next 10 minutes. Finally, once they were all removed, the doctor had the talk with the woman about sex education, and that rubber bands were not a successful contraceptive, and not what they meant by wearing a rubber, and then wrote her a prescription for ABX. TLDR, Mom was a nurse who had a patient use rubber bands as a contraceptive device who ended up with a severe infection that required medical attention to get them removed. To be 100% serious, this is why proper sex education is so critically important. Dentist here, things I've had to explain to parents. 1. Breast milk can cause cavities. 2. Don't put your kids to bed with a bottle of Coke in it. They then switched to Diet Coke. Facepalm. 3. Don't wiggle out your permanent teeth just because the tooth fairy will give you money. 4. You can't brush cavities away with toothpaste, or any of these new internet fads. Oil pulling, honey, chocolate. Once your cavity is deep enough, it needs to be fixed by a dentist. 5. Fluoride isn't poison any more than table salt is poison. Small quantities are good for you. Anyone who tells you otherwise has been lied to and believed it. I have plenty more, but I'd have to think harder. I had apple juice bottles as a baby. I had cavities. My younger siblings didn't have apple juice bottles as babies. They didn't get cavities. Proof my parents are capable of learning. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo and doesn't only attack cancer cells because it likes the acid environment in it. This type of snake oil pisses me off. How did they respond? With so many fallacious, stupid arguments. Like, yes, but they drink that in a small remote village in the Amazonian forest, and they don't have any cases of lung cancer. Maybe it's because they don't smoke and don't have CT scans or biopsies. My sister is a doctor, and 25 years ago, when she had her very first patient out of residency, and this patient refused to allow her to see her breasts, which were sore and needed a mammogram to check out a lump. So sister asks why, and this girl, who was about 30 and single, said matter-of-factly, "Oh, that's lesbian. We can't do that. It's against the Lord's wishes." She loves telling this story at the dinner table at family gatherings, especially to our religious side. Then why didn't she ask for a male doctor? Oh, right, because that's sinful too. I guess God just wants you to have breast cancer. The way I imagined it really went down is that the woman didn't know why my sister had to physically check the lump. She just thought, I'm gonna get a mammogram, and no need to get all feely. This was in rural Pennsylvania. Not a doctor, but I regularly have people come in for eye examinations because when I take off my glasses, things are blurry. Often these aren't passing comments during the exam, but the main reason for their visit to the clinic. Why do they think they wear glasses? Paramedic here was driving with my partner and a patient in the back. The patient was fine. The patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. Him. So, when cats and dogs eat grass, that means they have cancer, right? Me. No, it does not. Made for an awkwardly silent ride the rest of the way. What? And really, why did he even assume a paramedic would know whether or not animals have cancer? Had to explain to an adult, you have to brush all the sides of your teeth. Like, no, just the side that shows when you smile is not enough. And yes, flossing is not just a thing for rich people. Flossing is for people rich on time, or for people with a dentist appointment later that week. My dad told me about an extremely religious male patient who was concerned about his nocturnal emissions. He saw it as an offense to God and wanted to know what he could do to stop it. My dad's response? Well, it's gotta go somewhere, guy. Better out than in, I always say. Christ, the number of times I have to explain colds to adults. You're 40 years old and you've probably had 100 of these. How have you not figured this out yet? Do you come to the doctor every time? Antibiotics won't help. Drink fluids, Sudafed, and write this crap down for next time. Also, I need a doctor's note for missing work. Yes, I'm an adult. I know it's ridiculous. Exactly this. It's naive to think that people are so stupid they go to the doctor for a cold, but the truth is it's just bureaucracy making you go. If you're too ill to work due to the virus, you still have to go to the doctor to prove you're ill. While on dermatological rotation, a Middle Eastern patient saw me with what she described as some funny itching growth in her butt crack. Some quick investigation revealed it to be a severe case of genital warts. I explained the diagnosis and that it was an STD until she shockingly assured me that she was still a virgin. Now, virginity is a big issue for young Muslim women, or perhaps their families even more, but apparently that doesn't cover anal sex, and therefore no birth control in the form of, say, condoms was needed. I was working in GP and had a patient scheduled for an appointment. Looked through his notes to gain an idea of why he may be seeing me and saw he'd been seen a few times with knee pains/shoulder pains and the like. The guy's in his 70s, so probably just arthritis. I'm thinking I'll do an examination of his sore joints and ask a few questions, prescribe some painkillers, and it'll be a quick one. Call him in, and he walks in and sits down and is cheery as anything. What seems to be the problem then, sir? I notice you've had some issues recently with sore joints, I ask. He then proceeds to tell me about his sore knee. So I check his knee and take a history, and it all seems fine. Ask anything else, and he's like, oh, actually, my neck is sore too. So I check his neck, and nothing untoward is to be found there either. At this point, he's like, okay, well, thanks, doc, I'll be off then. I say to him, oh, good, glad we could help. And you have no other pains at all before you go? He then sits back down and tells me he's been having central crushing chest pain radiating down his left arm and into his jaw since last night, and has been feeling breathless, and when it happened, he had an impending sense of doom. I know a lot of you won't be doctors here, but I'm sure you all recognize signs of an MI there. He had all the classic textbook symptoms. Called an ambulance, and he was rushed to the hospital for PCI. A friend nurse told me that an old man was prescribed suppositories for something he had. A couple of days later, he came back feeling worse and said the tablets were not doing anything. Yep, he was eating them. He had to be explained that suppositories are PR. Roommate was talking about how she often had unprotected sex in non-monogamous situations because condoms irritated her vag for days afterwards. I had to explain the concept of a latex allergy and the alternative Jimmy hats to a woman who had been sexually active for 12 years. Thanks for watching until the end. Be sure to stop by the channel, subscribe, and check out another video.